Sometimes I get patients who wait because they didn't want to bother me, or they thought nothing of it, or they wanted to see if it would go away on its own. Some ended up in the hospital. So please keep your doctor, through your nurse, in the loop. It's so important. The first is chemotherapy-induced nausea and vomiting, what we usually refer to in the medical field as CINV. Thanks to those pre-medications, we've been able to eliminate the majority of the risk of that severe form of the nausea and vomiting. Medications you'll hear of usually are like Emend, Alopecia, Zofran. Even with those, you may still have some residual amount of nausea at home. It should not be severe by any means, but for that, you should be prepared, and your team usually prepares you for that and gives you a prescription for Compazine, Zofran, or both, and sometimes even adding a third nausea medication to be prepared for at home. And yes, you've guessed it, everybody's different. Some patients don't get a hint of nausea, and others may be nauseated constantly, day and night, on multiple scheduled nausea medications around the clock. Those poor folks, I have to sometimes have them come in for IV fluids and IV nausea medications, as they may not be keeping stuff down. Thankfully, the latter scenario is the exception to the rule. What about infusion reactions? Again, virtually zero risk with many chemo drugs, but there is a small but real risk of infusion reactions with others, and that risk can be mitigated with the use of corticosteroids such as dexamethasone. Corticosteroids are used as part of the concoction I just mentioned for nausea prevention, and they're pretty awesome drugs, miraculous drugs, but nothing comes without a price. Just remember that. I can elaborate on steroids in general in cancer treatment. Just let me know in the comments below. Now, you may take your pre-medications all as a lump sum right before your chemo in an IV form, or you may take part of them as an oral form before your chemo, after your chemo, or sandwich around your chemo. And that depends on the regimen, the chemo you're getting, and the person. So what happens when you get home? Well, I call the first week or two the aftermath. That's when most of the side effects will start and hopefully go away. The truth is, this is the aftermath of when chemotherapy roamed around in your system for those short hours or few days after you received it. It depends on how fast your systems recuperate and regenerate to make up for that. But I digress. Now, the risk of nausea happens in the first 5 to 7 days, and that is part of the reason you get these pre-medications before your chemo. Fatigue may kick in after maybe a few days or right after chemo, and it depends whether or not you received steroids. You see, some people feel like they can lift mountains right after they get chemotherapy, and then a couple, 3 or 4 days later, they feel like they've fallen off a cliff. And that is the effect of corticosteroids. They probably received dexamethasone as part of their pre-medication regimen. I'm sorry to tell you that, but this is a common occurrence in my patients. The next side effect is immune suppression or neutropenia, which means weakening of your immune system through lowering your white cell count, specifically the neutrophil part of it. And that is responsible for fighting infections, especially the most life-threatening infections that happen to people with low counts when they get chemotherapy. It can cause anemia by lowering your red cell count. It can cause thrombocytopenia, oof, mouthful, if it lowers your platelet counts. And all of this depends on the type of chemotherapy you get, how many chemotherapies you get at once, and the person getting chemotherapy. Now, fortunately, for most cancers, especially solid tumors, and those are any cancers that are not leukemias or lymphomas, this is a short-lived process, and it's very important to distinguish that from what can happen with leukemias and lymphomas. So it's a short-lived process, and your counts typically take a dive, what we call a nadir point, and then it bounces back to normal by the time you're back for the next cycle. Again, everybody's different in whether or not this happens and how long it happens for. The majority, though, should be somewhere within the expected duration of recovery. What does that mean? Well, you'll be immune compromised pretty much for at least half of your cycle length. I usually tell my patients to consider themselves immunocompromised for the entirety of their cycle, just to be on the safe side. You may not have blood work in between your chemo days, which is fine, but even if you do, it won't be very helpful or cost-effective, and it won't change the precautions that you have to go through anyway. And that is for a lot of cancers, not for all cancers. Next is messed up taste buds and poor appetite. Surprisingly, not every patient on chemotherapy will lose weight. If you're a breast cancer patient, disclaimer, and you're not going to like this, but you will likely gain weight, or at the least not lose any weight by the end of your chemo regimen. Now, if you have stage 4 lung, especially esophageal or gastric cancers, you'll likely lose weight, and you'll have to be proactive and prepare for this likely possibility. The last thing you want is to lose weight while you're on chemotherapy, because that's not a good combination. Next is mouth sores, sore mouth or gums, and less commonly, loose teeth. Again, not a common occurrence, but it tends to happen with different offenders, and certainly eating sour foods and spicy foods can speed up that process. Next side effect is constipation, diarrhea, or neither. Again, depends on the chemotherapy you're getting and the person getting it. If you're wondering about the specific chemotherapy you're getting and whether or not it's likely to cause one or the other, just let me know in the comments below. I'll be happy to help. Next is dry skin. This is almost a class effect. Next is alopecia. Certainly does not happen with every chemo drug. Breast cancer regimens are almost all associated with that risk just because of the common agents that are used within them. In contrast to that, colon cancer regimens are almost never associated with that. Next, peripheral neuropathy. This is not a class effect and is not expected with all chemo drugs, but it certainly can happen depending on the person and the agent you're getting. Next, hand-foot syndrome. Again, a unique side effect that we see commonly with certain chemo drugs such as oral Xeloda, or the generic of that is called capecitabine. There are other oral targeted medications and other injectable IV chemotherapies that may cause that, but the targeted therapies we're going to cover in the biologic and targeted therapy part of this cancer treatment series, so make sure you check that out. Now, we have other unique side effects such as, high blood pressure, lung inflammation, what we call pneumonitis, drowsiness, and there's a less than 1% chance of heart failure or leukemia with one of the most commonly used class of chemotherapy drugs used in breast cancer, leukemia, and lymphoma, and that's called anthracyclines. Anthracyclines include doxorubicin, epirubicin, idarubicin, daunorubicin. Again, risks and benefits discussion should happen with your oncologist if you're getting this class of chemo. But for the most part, I want you to know that if we recommend anthracyclines to our patients, that is because their benefits far outweigh their risks. But nonetheless, you should know of those risks either way, and you should make sure you discuss clearly and understand what your oncologist is explaining to you about the benefits and the risks. Next, I'm going to cover a few pointers to stay out of trouble at home or deal with the side effects that you're experiencing from chemotherapy.